This is the question. If your previous sleeve gastrectomy fails for the weight loss, is it possible to perform another sleeve gastrectomy as a revisional surgery? The answer is yes, it's probably yes. But for me as a surgeon, I'm not recommend this one for my patients. There's two reasons of this situation. One is if a procedure fails to achieve weight loss, the correction of this problem with the same operation has high risk of fail again. The other thing is resleeve also is a hard thing to do because you have already a thin and tube structured stomach. Make it another sleeve, make it more narrow or make it very thin, it has some surgical problems because the leakage rates increases for resleeve procedures because you have operated tissue before. That's why sometimes somehow the staple line may have leakage. That's why I do not recommend resleeve gastrectomy for my patients. But in the literature, as a revisional surgery list, the resleeve gastrectomy is in the list. That's my opinion. Resleeve is a procedure that we can use as a revisional surgery, but as I tell about the procedure details, for that reason, I'm not recommend my patients resleeve. If I have a patient who have sleeve gastrectomy before and failed for the weight loss, I'm usually recommend them to have gastric bypass or something like these operations because adding a malabsorption will increase the success rates. Only resleeve meaning that you will create just only a restriction without malabsorption, because if sleeve fails, it's recommended to add it on a malabsorption. That's all. Thank you very much.